Okay, so today we will discuss sacrum. Okay, so we will discuss the sacrum under these following headings: first, introduction, then anatomical position, attachments, sexual dimorphism, ossification, and clinical correlations. So, first, introduction. Okay, so this yellow colored one forming part of the pelvic cavity, that is sacrum, triangular bone. See here, this is sacrum, okay, formed by fusion of 5 sacral vertebrae. So sacrum means sacred in Latin, and it is a wedge-shaped or triangular bone formed by fusion of 5 sacral vertebrae, articulates on either side with the hip bone to form the sacroiliac joint. Okay, see here, this is pelvis. You can see articulation of sacrum with the two hip bones to form the sacroiliac joints. And what is the function? It supports the vertebral column and forms the posterior part of bony pelvis. It transmits the weight of the body to the pelvic girdle through the sacroiliac joint. What are the presenting parts? Okay, sacrum is very commonly given in your viva table, axial skeleton viva. Bone stable, axial skeleton, bone stable. So these are the presenting parts. It has a base is also known as superior surface. It articulates with fifth lumbar vertebra at the lumbosacral angle. Apex is directed inferiorly, articulates with the coccyx, and surfaces are anterior surface or pelvic surface. Here this surface you are saying, this is anterior surface or pelvic surface. Posterior surface and or dorsal surface lying posteriorly, right lateral surface and left lateral surfaces are present. Okay, so there are 4 surfaces: base and apex. Okay, understood. So what will be the anatomical position? So sacrum is a midline bone placed between the two hip bones and fifth lumbar vertebra superiorly, coccyx inferiorly. Here it articulates with the fifth lumbar vertebra. Here it is articulating with the coccyx. So this yellow colored one is the sacrum. So how will you determine the anatomical position? Upper surface of the body of first sacral vertebra slopes forward at an angle of about 30 degrees, and smooth pelvic or anterior surface of sacrum faces downward and forward, and the upper end of the sacral canal is directed almost upward and slightly backward. So see here, this will be the anatomical position of the sacrum, like it is stooping forward to pick up something. Okay, so this surface is the pelvic surface. Posteriorly, this rough surface is the dorsal surface. On the two sides are the two lateral surfaces, and this is the base containing the body of the first sacral vertebra. Here is the apex, here articulates the coccyx. There are 4 pairs of sacral foramina in between the 5 sacral vertebrae. So ventrally there is ventral sacral foramina, posteriorly there is dorsal sacral foramina, and the vertebral canal of all the vertebrae are fused to form the sacral canal. So this canal you can see here, this is sacral canal. Okay, understood. So upper end of the sacral canal is also included within the base of the sacrum, and here is one U-shaped gap that is known as sacral hiatus, and on the two sides of the hiatus this projecting part is known as the sacral cornu. Okay, and this angle is inferolateral angle. Here is one, here is another one. Here actually coccyx is attached with the sacrum. This is coccygeal cornu, these are sacral cornu. These are connected by intercornular ligaments. Okay, And these inferior lateral angles are also connected with the coccyx via ligaments, lateral sacrococcygeal ligaments. Okay. Okay, so anatomical position is clear. Uh, Pelvic surface is directed and dorsal surface is directed backward and upward, and pelvic surface is directed forward and downward. Okay, and base is, that means the body of first sacral vertebra is forming an angle of 30 degree. It slopes forward and forming an angle of about 30 degrees. Now we will discuss the presenting parts in details. So general features of sacrum are base, apex. Four surfaces are the pelvic or anterior surface, dorsal or posterior surface, right lateral surface, left lateral surface, and sacral canal. So first we will discuss the base. So this part you see from above, this is base of the sacrum. Base is directed upward and forward, and it is formed by the upper surface of first sacral vertebra here, and consists of the body and the upper surface of lateral mass or ala on each side of the body. Okay, these are the, this wing of butterfly like structure, this is the ala of the sacrum. Okay, it is formed by anterior 2/3 is formed by costal elements, posterior 1/3 is formed by the transverse element. Costal elements, okay, so it is formed by upper surface of first sacral vertebra and consists of body and the upper surface of lateral mass or ala on each side of the body. These are forming the base. Upper end of sacral canal, this part is upper end of sacral canal, is enclosed between the pedicle and lamina. This part is pedicle, here is the lamina. So it is enclosed by these two structures. And superior articular process. These processes are superior articular process of first sacral vertebra are also included in the base. Okay, and the body of first sacral vertebra is large and much wider in transverse diameter. See, it is oval in shape. Transverse diameter is more than the anteroposterior diameter. And its projecting anterior edge. This is anterior edge. This is known as sacral promontory. Very frequently asked question. What is sacral promontory? Okay, and different diameters are measured from this sacral promontory. That's why it has clinical importance also. So anterior edge of the body of the first sacral vertebra is prominent and projecting forward, that is known as sacral promontory, and it is tilted forward and forms a prominent lumbosacral angle with the body of fifth lumbar vertebra and the intervening disc. The promontory gives attachment to lower end of anterior longitudinal ligament, and the posterior longitudinal ligament is attached to the posterior edge of body. Here anterior longitudinal ligament, here is posterior longitudinal ligament. Okay. So, and each ala of the sacrum, this part is ala, is formed by fusion of costal element in anterior 2/3. Here is the costal element, and true transverse element in the posterior 1/3. Here, transverse element. It forms the base of the lumbosacral triangle and presents a lateral rough part, medial smooth concave part. Lateral rough part and medial smooth concave part. Lateral part is overlapped by psoas major muscle and gives attachment to lumbosacral and ventral sacroiliac ligaments. Okay, these are ventral sacroiliac ligament is ligament of sacroiliac joint lying anteriorly. And there are three sacroiliac ligaments: ventral, dorsal, and interosseous, connecting the sacrum and ilium, and to a part of iliacus muscle. Here iliacus muscle has been shown, attachment of iliacus muscle. The medial part is crossed vertically by the following structures from lateral to medial. Oil structure. Okay. This medial part is crossed by these four structures. From lateral to medial, this is obturator nerve, iliolumbar artery. Here is lumbosacral trunk and sympathetic trunk. Okay, three nervous structure and one vessel. Okay, understood? This is very, very important. While structure very frequently given in your OSPI, Viva, also in theory. Okay, while structure in MCQ also. Oil structure O, from lateral to medial, the structure is present. O is obturator nerve, I is iliolumbar artery, L is lumbosacral trunk, S is sympathetic trunk. Okay, understood? So the upper opening of the sacral canal contains the caudal extension of the cauda equina and spinal meninges, and the ligamenta flava are attached to the upper borders of the lamina. The superior vertebral notches transmit the fifth pair of lumbar nerves, and the superior articular facets are concave and backward and faces backward and medially. See, this is the superior articular process of first sacral vertebra. This is concave and facing backward and medial, and meet with the reciprocally curved inferior articular facets of fifth lumbar vertebra, forming the zygapophyseal joints. Okay. Next, we go to the apex. Here is the apex. Apex is directed below, formed by the oval shaped lower surface of the body of fifth sacral vertebra, and it meets with the body of the first coccygeal vertebra at the sacrococcygeal joint. Okay, this is apex. We are viewing from below. Next, we go to the surfaces. So, base, apex you have discussed. Next, go to surfaces. First, the pelvic surface, which is lying, which is directed downward and forward. Okay. So, it is concave both vertically and transversely. Vertically and transversely concave. Facing downward and forward in anatomical position. These are the features. There are transverse ridges. These are the transverse ridges. Four ridges in between five vertebra. Okay. The median area is marked by four transverse ridges which indicate the line of fusion of the bodies of five sacral vertebrae. There are pelvic sacral foramina. These are the four pairs of pelvic sacral foramina. The ridges end on either side at the four pairs of pelvic sacral foramina, and which communicate with the sacral canal through the intervertebral foramina. The bony bars between the foramina represents the costal elements. See, these are the bony bars in between the foramina. They represent the costal element. And ventral rami of the upper four sacral nerves and lateral sacral arteries comes out through this foramina. Here you can see these are the ventral rami of the upper four sacral nerves, and also the branches of lateral sacral arteries are coming out through this foramina. This is important. Which structure is passing through which foramina? Okay. Next is lateral mass. Lateral to the foramina, these parts are known as lateral mass. Lateral to the foramina, the costal elements unite with each other and with the transverse processes to form the lateral mass of the sacrum. The sacral ala represents the upper surface of the lateral mass. Okay, understood? And see, the ventral rami are joining with each other and forming the sacral plexus here. These are the branches of sacral plexus you have read during gluteal region, sciatic nerve, pudendal nerve, and lumbosacral plexus is giving all the nerves to the lower extremity. So, next, relations of the pelvic surface. See, all these structures are related to it. In the midline, there is median sacral artery. Here is the superior rectal artery. It is lying on one side. On the two sides, there are two sympathetic chains, and they two chains are joining to form a ganglion impulse at the level of first coccygeal vertebra. So, this part is coccyx. Up to this level is the sacrum. Okay, and there is E-shaped origin of the piriformis. This is vertical limb, and these are the transverse limbs of the E. And here is attachment of the coccygeus muscle. Okay, on the pelvic surface. Okay, so we will discuss this median sacral vessels in the midline here ganglionated sympathetic trunk along the medial margin of pelvic sacral foramina. See, this is the medial margin of pelvic sacral foramina. Here lies the ganglionated sympathetic trunk. Lateral to the foramina, lateral sacral vessels. Here, this is lateral sacral vessels, lateral to the foramina. Parietal peritoneum covers the front of the bodies of upper 2.5 sacral vertebra, except the root of the attachment of sigmoid colon to the left of the middle line. Okay. Rest of the pelvic surface distal to the body of third sacral vertebra is non-peritoneal and related to the rectum, with the bifurcation of the superior renal artery intervening between the rectum and third sacral vertebra. Okay. Next we go to the attachments. There is attachment of piriformis muscle. It takes a E-shaped origin, vertical limb from the continuous anterior surface of lateral mass and the three horizontal limbs from the bony bars between the four pelvic sacral foramina. Coccygeus muscle, here is attachment of coccygeus muscle at the inferolateral angle, and sacrospinal ligament. It is also attached at this inferolateral angle. Okay. Next, so we have completed the relations and attachments of the pelvic surface. Next, we go to dorsal surface. Dorsal surface is rough, like this. Okay. So it is rough. This is original view of the dorsal surface. So it is rough, convex, directed upward and backward in anatomical position, and it is marked by four pairs of dorsal sacral foramina. These are the dorsal sacral foramina. Okay. And five prominent vertical ridges are present on the dorsal surface. Five vertical crest, median sacral crest, two intermediate sacral crest, and two lateral sacral crest. Median sacral crest, the central ridges. See, this is one line in the midline is the median sacral crest. Central ridge bears four spinal tubercles representing the fused spines of upper four sacral vertebra. Lateral to the median crest, the posterior surface is formed by fused lamina. Here, this part is formed by fused lamina. Laminars are part of the vertebra, okay, vertebral arch. Two intermediate sacral crest, medial to the foramina and lateral to the lamina. Here is the intermediate sacral crest, medial to the foramina, lateral to the lamina, in line with the superior articular process of the first sacral vertebra. See, this is superior articular process, and this intermediate crest is lying in the line with this articular process. And there are four articular tubercles representing the fused articular processes of adjacent vertebra. Okay. Next are the two lateral sacral crest, lateral to the foramina. See, this is lateral to the foramina. This crest is lateral sacral crest. Lateral to the foramina, there is lateral sacral crest on which there are transverse tubercles representing the fused transverse processes. Okay. So this median sacral crest is formed by fusion of spinous processes. Intermediate sacral crest formed by fusion of superior inferior articular processes. And this lateral sacral crest is formed by fusion of transverse processes, okay, of the sacral vertebra. So this is dorsal surface. Its relations are different attachments. Next we go to sacral hiatus. These are important features. Structures passing through sacral hiatus, very frequently asked in your viva table. Structures passing through sacral hiatus and how the sacral hiatus is formed. You have to show the sacral hiatus in the bony specimen. Also given in your OSPE, if bone is given in OSPE. So sacral hiatus, below the fourth spine, there lies an inverted U-shaped gap. Here, this gap. Okay, 1, 2, 3, 4, fourth spine, there is a gap. And the sacral hiatus is formed due to failure of fusion of lamina of fifth sacral vertebra. And it transmits the fifth sacral nerve, a pair of coccygeal nerves, phylum terminal, which passes to the coccyx. Okay, this line is representing final terminal going to the coccyx. Next, we go to sacral cornu. This projecting part is the sacral cornu. The inferior articular processes of the fifth sacral vertebra are free and form the sacral cornu. Cornu means Latin horn-like structure, which project downward at the sides of sacral hiatus, and intercornual ligaments connect the sacrum with the coccygeal cornu. Okay. Next, we go to the dorsal sacral foramina. Four pairs are present lateral to the intermediate sacral crest. Here, lateral to the intermediate sacral crest, four pairs of dorsal sacral foramina are present. It transmits the dorsal rami of upper four sacral nerves. Fifth sacral nerve is passing through the sacral hiatus, so upper four nerves are passing through this dorsal sacral foramina. Transverse processes of the fifth sacral vertebra form the inferolateral angles of the sacrum. Here, these inferolateral angles are formed by the transverse processes of fifth sacral vertebra, and which are connected with the rudimentary transverse process of first coccygeal vertebra by the lateral sacrococcygeal ligaments. See, this is transverse process of first coccygeal vertebra. Inferolateral angle is connected with the transverse process of first coccygeal vertebra by this lateral sacrococcygeal ligament. Okay, understood? Next, muscle attachment. Attachment of erectus spinae muscle. There is U-shaped attachment of erectus spinae muscle. It gains attachment to the dorsal surface from an elongated U-shaped area involving continuous rows of the spinous and transverse tubercles. Okay. Here is the spinous tubercles, here are the transverse tubercles. Multifidus muscle. This shaded area is for multifidus muscle. It takes origin from the enclosed area beneath the erector spine. Okay, the area enclosed by erector spine. And gluteus maximus muscle from the inferolateral angle here. From here, gluteus maximus muscle. Okay, from the gluteal surface of the sacrum, and from here also from the inferolateral gluteal surface of the hip bone. Okay, and from the inferolateral angle of the sacrum. And sacrotuberous ligament is also attached here at the inferolateral angle, connecting the sacrum with the ischial tuberosity. You have read sacrotuberous and sacrospinous ligaments are forming the superior, greater and lesser sciatic notches into foramens. Next, we go to lateral surface. So, we have completed dorsal surface, its attachments, different foramina, okay, like this. Next, go to lateral surface. This is lateral view of the sacrum. There is a inverted L-shaped articular surface, which is articulating with the hip bone, forming the sacroiliac joints. It belongs to lateral mass of sacrum formed by fusion of costal and true transverse elements. It is broad in the upper part and narrow in the lower part, where it turns abruptly medially to form the inferior angle of the sacrum. Inferolateral angle. Here is the inferolateral angle you have seen in anterior and posterior view. The broad upper part presents an inverted L-shaped articular surface. This is inverted L-shaped articular surface in front and a rough, deeply pitted area behind. This is rough area. The articular surface articulates with the corresponding surface of ilium and forms the plain synovial type of sacroiliac joint. Here it forms the sacroiliac joint. And the lower narrow part of lateral surface here, opposite the inferolateral angle, gives attachment from behind forward these structures. Okay, from behind on the posterior surface, it gives attachment to gluteus maximus muscle, which encroaches on the dorsal surface, sacrotuberous ligament, sacrospinous ligament, and coccygeus muscle encroaches on the pelvic surface. So all four are attached to the inferolateral angle. Next we go to sacral canal. Sacral canal is formed by superimposed vertebral foramina of the 5 sacral vertebrae and extends caudally up to the sacral hiatus here. It communicates with the pelvic and dorsal sacral foramina through the intervertebral foramina. Sacral canal contains lower part of cauda equina formed by lower 4 pairs of lumbar, 5 pairs of sacral and 1 pair of coccygeal nerves. Phylum terminal, spinal meninges and subdural and subarachnoid space and lateral sacral vessels. All these are passes through sacral canal. Okay, this is also asked in your viva. Sacral hiatus is very important. If you hold the sacrum, everyone will be asked about sacral hiatus. Okay, sacral canal content is also asked. Dura mater, and this level is important. Dura mater and arachnoid mater extends up to S2 vertebral level, which passes through the line joining the posterior superior iliac spine. Okay, posterior superior iliac spine of hip bone. If you join the posterior superior iliac spine of both sides, this line will pass through this S2 vertebral level, up to which the dura mater and arachnoid mater. These are layers of meninges extends up to this level. Pia mater ends at the L1. Okay, where the spinal cord ends, pia mater ends there. Okay, and phylum terminal is one extension of the pia mater, which is extending up to the coccygeus, first coccygeal vertebra. Next, we go to sexual dimorphism of sacrum. What is the difference in male and female sacrum? Okay, male female difference you have to know for sacrum and also for the pelvis. These are very important, very frequently asked in your viva. Male difference in male and female in sacrum, also in the pelvis. So, length. Male sacrum length is more, in female length is less. These are the differences. Ratio between the transverse width of the body and of first sacral vertebra and the entire width of the sacral base. You can see this is width of the body and entire width of the base. This ratio. This ratio is more than 1/3 in case of male. That means this body of the first sacral vertebra is more wider. That's why the ratio is more than 1/3, and it is less in case of female, less than 1/3 in case of female. And articular surface means this one, this inverted L-shaped articular surface on the lateral mass. This is relatively longer, extend up to upper 3 segments. Okay, so this is probably one male sacrum. So it extends up to upper 3 segments of the sacral vertebra. And this female sacrum, it is smaller, occupies only upper 2 segments of the sacrum. Anterior surface of the sacrum here. Anterior surface or pelvic surface is shallower in case of male and it is deeper in case of female. And sacral index. Sacral index is maximum breadth of the base of the sacrum divided by maximum length into 100. That's how you calculate the sacral index. Breadth by length into 100. And breadth is taken at the base of the sacrum. So it is lesser. That means in male sacrum length is more, so index will be less. So, and in female sacrum breadth is more, length is also less, so it will be greater. The index is more than the male. It is about 115 and here it is 105. Width is relatively narrower. This is the width of the sacrum is relatively narrower in male and it is broader in case of female. All these changes in females, they helps in childbirth process. Okay. And curvature is uniformly curved in male sacrum and it is flattened in the upper part and sharply curved in the lower part in case of female. Okay. So this you remember. Next we go to ossification. Ossification of sacrum should be regarded as the ossification of 5 separate vertebrae, and each of the 5 sacral segments is ossified from 3 primary centers, one for the centrum and one each for the vertebral arch. However, upper 3 vertebrae have additional primary centers for the costal buds. Okay. Upper 3 vertebrae have additional primary centers for the costal buds. Thus, there are 21 primary centers, 5 for the body, 10 for the arches, 6 for the costal buds. And there are 14 secondary centers, 10 for epiphysis of the bodies, 2 for the articular surfaces, and 2 for the margins below the articular surfaces. The primary centers appears between 2nd and 8th week of fetal life and fuse with each other between 2nd and 8th years of life. Secondary centers appear at puberty and fuse by 25 years. Okay. Next we go to clinical correlation. These are very important for your viva, clinical correlations, and also comes as a short note. Sacralization, lumbarization, these are important. Okay. So you understand it. Sacralization is congenital anomaly. Other vertebra is fusing with the sacrum here, sacralization. So incorporation of fifth lumbar vertebra and first coccygeal vertebra in the sacrum. This is known as sacralization. And number of sacral foramina is increased unilaterally or bilaterally. See here, here this is normal sacrum. Here fifth lumbar vertebra is fused with the first sacral vertebra on one side, unilateral sacralization. Okay, so on this side you can see 5 sacral foraminas. Okay, if in both side fusions occur, 5 pairs of sacral foramina you will get. We have this kind of specimen here. You can see this is mainly coccyx is fused with the sacrum. That's why 5 pairs of sacral foramina you can see here. Or you can say ossification of intercornual ligament has occurred here. And in this specimen also you can see fifth lumbar vertebra here fusing with the sacrum. Okay, 5 pairs of sacral foramina you can see here. Understood? Next, we go to lumbarization. Lumbarization means one of the sacral vertebra will fuse with fifth lumbar. First sacral is fused with fifth lumbar. First sacral vertebra is separated from the sacrum and fused with the fifth lumbar vertebra. That is known as lumbarization. And number of sacral foramina here it will be reduced to 3 in number, 3 pairs of sacral foramina. So S1 is fused with the lumbar. S1, S2, S3, S4, S5. Okay, understood? Next we go to spina bifida. This is also a important short note, spina bifida. Extensive failure of fusion of lamina of the adjacent vertebra is occasionally observed at congenital defect and is known as spina bifida. Okay, generally there is absence of fusion of lamina of fifth sacral vertebra to form the sacral hiatus. If for other sacral vertebra there is absence of fusion of this lamina, it is called spina bifida. Okay. Importance of sacral hiatus. Sometimes the anesthetic agents are injected through the sacral hiatus in the epidural or caudal anesthesia. Okay, in cesarean section, you have seen needle is pushed through the epidural space to act on the sacral and coccygeal nerves, and this is often employed to relax the perineal musculature for painless childbirth. Okay, understood? So for epidural anesthesia also sacral hiatus is important. That's why it is asked in your viva question, which structures are passing through the sacral hiatus. Those nerves you have to block, and where these nerves are supplying in the perineal region and some part of the inferior extremity. So these are some important questions. Sacral cornu is formed by which part of the sacrum? Mention the structures passing through the sacral hiatus. And ala of the sacrum is formed by which elements? Costal and transverse elements. What is lumbarization? And dura mater, arachnoid mater extends up to which level of sacrum? S2. Okay. So these are important viva question also come in your theory. Okay. Understood? Okay, so what will be the anatomical position? Okay, so the plane of the body of the first sacral vertebra will form a angle of 30 degree with the horizontal. Okay, this pelvic surface is directed downward and forward, and this rough dorsal surface is directed upward and backward. So you hold it the sacrum like this. Okay, with both of your hands you can hold it because it is a midline bone. Only one sacrum is present in our body and formed by fusion of 5 sacral vertebrae. Okay, understood? So this will be the anatomical position of sacrum. Okay, it looks like sacrum is stooped forward to pick up something. Okay, so the 3 points you remember: angle formation 30 degree, pelvic surface is directed downward forward, dorsal surface is rough surface, it is directed upward and backward. Okay, understood? And articulation is asked: sacroiliac joint, type of joint is plain synovial, and this body articulates with fifth lumbar vertebra. Here in the apex articulates with the first coccygeal vertebra. Okay, and this articular processes articulates with the articular processes of lumbar vertebra. Okay, so understood? And these clinical aspects are important, very, very important. And this is sacral hiatus, sacral cornu. Okay, this is inferolateral angle. This is inverted L-shaped articular surface. So this is pelvic surface, dorsal surface has 5 crest, midline is the median sacral crest. Just medial to the foraminas are the intermediate sacral crest, lateral to the foramina, lateral sacral crest. Median sacral crest formed by the spinal processes, intermediate sacral crest formed by the articular processes, superior and inferior articular processes, lateral sacral crest are formed by the transverse processes. Okay, and this part is base of the sacrum. Here is the apex of the sacrum. Base is formed by body of first sacral vertebra. Anterior margin is known as sacral promontory, and this wing shaped structure is the sacral ala. Here oil structure is related from lateral to medial. Obturator nerve, iliolumbar artery, lumbosacral trunk, and sympathetic chain. Okay, oil structure very frequently asked. Okay, that's all. Any queries? So you will be able to hold the sacrum in anatomical position. Okay, and read the attachments. Very few muscle attachments are there and structures passing through the foramens you read. Okay, that's all. Thank